Okay, there we go. So for the first question that I have, how did you handle the application process to DO MD school? Like in the sense of like managing everything you have to do.
Yeah, so I think the thing that really helped with like managing everything I needed to do, especially with two processes happening at the same time, was probably like just having like a little tracker like that I have. The good thing about the application for MD schools is that it's kind of like one application. As soon as you finish everything in that one application, you basically can send it to as many schools as you want. Whereas the DO one, you have to do specific applications for each school. So that's where it gets a little bit wonky, unfortunately.
Mhm.
But yeah, just staying on top of it. Like I know like the main things obviously is like having your personal statement done, having summaries of like your activities. And then on top of that, like taking the MCAT, obviously. The MCAT scores will get sent directly to the application format. And then for the application, you have to put in like your grades, your letter grades one by one, what semester
Yeah,
you took,
yeah,
how many units it was, what you got in the class, and then on top of that, you have to make sure to send your transcripts, and it'll give you like a step by step on how to do that as well. So with me, when it came to the application process, once I put in my primary applications, I like made a Google sheet of like all of the schools I applied to, and then as
mhm,
I would get secondaries, I would actually update like, oh, secondary received this time. I try to get them in within 2 weeks because they say about 2 weeks to a month. Some of them will have deadlines, some of them won't. It just
right.
depends on the school. And then what's really good is like, I guess, pre-writing. So you can usually go on
Mhm.
like Google and you can see the questions they ask for like secondaries like the year before. And most of the time they don't change much. It's the same question.
Yeah,
So it's just like starting to pre-write all your secondaries, especially if you're like applying to like 20 plus schools. It can get very complicated. And it can be a lot. Like if you get like five secondaries, for instance, all at the same time, it's like you're gonna be just grinding it, right?
right.
So yeah, just keeping track like that. Like I would like put a deadline. Okay, I want to have this one done by then so I can submit it by here, right?
Mhm.
That's about kind of how like I structured everything. Obviously, it's really important to like have some of the things that you can already have done before it actually opens. So like personal
Mhm.
statement, I would say like try to have a finalized thing by the time the application cycle opens. If you can't take the MCAT before and get a good score that you want, then cool. If you can't, it's fine. I took the MCAT while I was applying. And then as for the secondaries, like I said, pre-write, you don't have to pre-write them since like before you send the first application, but usually it takes about
Mhm.
a month, at least with the MD schools, for them to actually like certify it before they send it to the schools, and then they like start sending you like secondaries, for instance. So that's kind of how I went about it.
Yeah, yeah. So you use like you would try to get ahead of it, like of like
Yeah,
what it try to
exactly. I
figure
mean,
it out.
it
Yeah.
gets hard, obviously, because like especially when you have like your like everything in like and schools are like, okay, you meet like ARM records, like they'll send you a
Mhm.
secondary. So it's like there would be weeks where you'd get like, for instance, like five secondaries, and you're like, holy Lord, like I'm gonna have to do all this now. But
Uh-huh.
yeah, just keeping track of it, trying to stay within if they have a deadline, obviously try to get it in before the deadline. And if they don't, just try to make yourself accountable on like when
Yeah,
you want to be put it in. Because the sooner you get your secondary and the sooner you put it in, the sooner you're in the bunch of them where they're reviewing and starting to send out those interviews.
right. Right. Okay. And then so for the next one, if you could give advice to your past self about the application process, what would it be?
Definitely take the MCAT before you apply, and get the score you want because I feel like the score like opens a lot of doors for you.
Hmm.
Especially like if, for instance, you get like a 505 and higher as like a like low like a underserved population within medicine. I feel like that's really good.
Yeah.
Have someone that's done it before take a look at your application more than once, if anything, or you maybe even your personal statement, for instance, so they can like give you some pointers like, oh, I think this would sound better, or like maybe we should put it through Grammarly, or like this is a good story, like step by step, it shows like why you want to be a doctor kind of thing.
Right.
Because when it comes to everything else, like putting in like your grades, like it's just like a like timely manner, like you already have them. And then
Yeah.
this like activities, it's more like you just put in like descriptions of each activity. What I did is like I put the descriptions and also try to have kind of try to make a connection to medicine. Within
Hmm.
the activity section, you get to choose three most important like activities that you think are the most important to you or whatever and
Yeah.
like relate to medicine. So those ones you'll have an extra, not you'll have the description, but you can also like put a specific story on why it was most important to you kind of thing.
Yeah.
So
Yeah.
having those probably thought of already. Yeah.
Yeah, for sure. And they tell us that all the time too, like, oh, like keep track of your volunteer and all that stuff. And I feel like
Yes.
that's something I don't do. I'm just like, I just want to get the hours right now and just,
It's
but
very important
yeah,
because like they'll ask like little niche things like oh they'll like if you can provide like the name of the person that was in charge and like either an email or a phone number. I don't know if they actually contact them, but like having that information
yeah,
really accessible makes it so much easier once you're applying.
yeah, yeah. So for my next one, I'm pretty sure you've been asked this like a million times, but what inspired you to go into medicine?
I think with me specifically is like I grew up like I wasn't first generation myself, my mom was.
Mhm.
But like I grew up with like my family members, obviously, like grandparents, great grandparents, and like they all had like these like chronic conditions, right? And
Right.
very much preventable and like seeing like them have to go to the hospital for it and stuff, I was like, okay, well like maybe there's situations where you don't have to do this.
Yeah.
And that kind of like sparked it. It wasn't until like I went on my medical mission trip to Panama where I actually was like, you know what, I could really see myself doing this. Like I really enjoy this. And like all the other volunteer things I did like within the hospital, I'm like I really enjoy this. Um,
Yeah.
and then the thing that kind of was like, okay, yes, like this is what you want to do is like I had a stepdad that like had got sick with like liver cirrhosis. I
Hmm.
was like, well, I mean, if you have the education behind like maybe the bad thing about being like alcoholic
Yeah.
and stuff, like maybe this wouldn't have happened and then like future things won't happen, right? So I think
Right.
that's like the big thing for me is like a combination of like family, like family like history of like chronic illnesses, but then
Hmm.
also um like my experiences just strengthened it because it's like one thing for you to think like oh maybe I'll like it but like once you actually put yourself in like a situation where like you're either working in a hospital or you're volunteering at a hospital and like seeing all these
Yeah.
patients or like you're like scribing for instance or something like within the
Hmm.
hospital capacity and you're seeing the day-to-day how the doctor's like mind works like how they come up with like ways to like help their patients is where you kind of
Yeah.
get into you're like okay yeah this is something like I would love to do.
Yeah. Yeah.
Yeah.
So you would say like the hands-on experiences really encouraged you.
Yeah, definitely.
Um,
'Cause it's like at first it's like an idea, like, huh, maybe I want to, I really enjoy like helping people, like maybe medicine's for me. There's a lot of
mhm.
different careers like you can help people within, but I feel like you
Right.
really have to like immerse yourself within it, whether it's through, like I said, scribing, EMT, like anything that puts you in like a hospital, a clinic, or like helping people in some
Hmm.
capacity, I think is what really will drive you.
Yeah, it really helps it click.
Exactly, because I think that like one thing that a lot of people like that like struggle with is like sometimes if they don't have the like actual experience within the hospital or like within like clinics and stuff, they like come in, they're like, wait, we have to do all this or like what is
Yeah.
this? It's like if you have it before, you kind of already know what you're getting yourself into. And I feel
Yeah.
like it's important because to have that like why am I doing this? Because when you go into like hard blocks or like hard months and you're like, do I even want to do this? Like they remember
Yeah.
like, okay, yes, I remember why I'm doing this.
Hmm.
Mhm.
Yeah, for sure. And I guess my final one is not my final question, but of this general topic. What are the challenges of going into medicine? And I guess specifically, um, when I wrote this question, I think I was more so referring to the challenges of after the application process, medical school, and going practicing medicine after that.
Challenges of practicing medicine after that. Well, I
Uh-huh.
definitely think a big challenge is like even throughout medical school, I feel like
Yeah.
finances come into play a lot. Like you really have
Yeah.
to sit down with yourself and be like, okay, like I really have to like see this through because you're taking out thousands of dollars of loans sometimes.
Yeah.
And like on top of
You
that,
got
it's
to
like
get used to seeing that big old number.
yes, exactly. That's the first thing I think. The second thing I think is like when it comes to finishing medical school, they have this thing called match. And obviously, it's it's kind of like you have to do really well on like on your step or like licensing exams. And
Hmm.
depending on how well you do, like you go through this thing called match, and it's basically like once you like apply to a residency you want to go to, right? And then you'll go and you'll audition at different hospitals within that specialty. And then
Hmm.
once March comes around in your fourth year, you go through match, and like you could either match, which is great because then and then you like the end of the week they tell you where you're going to be for the next 4 to whatever years depending on your specialty. And then like also or you can unmatch and then you have to like go through soap and like it's just a lot of different things that like come into
Yeah,
play. So it's like really working hard through medical school to like be able to figure out which specialty you want to go towards and then also matching into that specialty. I think
right.
also being okay with like not knowing where you're going to be in the next 4 years. I think that's something that's difficult for me because I am such a planner. Like I want to know where I'm
Yeah,
going to be. But unfortunately, when it comes to matches, like if you match somewhere cool, but it's like, let's say you did like auditions not only like here, but you do them in like the Bay Area or you do them in LA or you do them out of state, right? And then you just
yeah,
happen to match like in Arizona or something, right? So it's like you have
right.
to be okay with like having to basically relocate your whole life over there.
Yeah,
Unfortunately, like that's what I think is probably one of the difficulties once you're finished.
yeah,
Being
yeah.
honest, I haven't gotten there obviously, so I can't really
But
like
it's on the back
say
of your
anything, but it's
mind.
always in the back of my mind when you're like planning, especially if you're like for instance if you have like a partner and like
Yeah,
possibly like thinking about them, having them understand like hey, like I might not it would have been a perfect world, I'll match back where we live, but if I don't,
right.
like what's gonna happen,
You
right?
gotta be ready.
Gotta be
Yeah.
ready to just
Yeah, and I've kind of heard about it for matching. Like, do they look at like obviously like the grades you get in medical school, but do they look at other like experience that you have?
definitely, I think definitely step scores. Obviously, like I think sometimes when it's better for you to be involved within medical school. Obviously, in the first like 6 months of med school, you're just getting used to it and stuff.
Yeah,
But yeah, like getting involved, whether it's in like clubs that's your like the med school offers or volunteering as well, I think it's really important. Kind of shows like you're not just in the books, like
yeah,
you're still branching out, right? To like
right.
make yourself a well-rounded person and stuff when it comes to the actual like matching.
Yeah. And this question is off the record. I don't have it written down. I don't want to take too much of your time. I don't want to do this too much, but I'm just curious. Would you say, I know you're just barely getting started, but would you say based on from other people you've met and how it's going so far, do you think you generally have time to do volunteer experience or to work or something like that while in medical school?
So work, I'm not sure. I think it's just dependent on what specifically you're going to be doing, right? Because like if you have like a
Hmm.
job, for instance, like you're like sitting at a desk, like just like check, like making sure like people like don't come in that don't belong there, and you can probably study like while
Yeah.
you're sitting at that desk, right? Whereas if you
Hmm.
have like a more like hands-on job, you can't be studying. It also depends on your time management. Like I know people that like are really good at time management when it comes to like the material. Like for instance, at our school, we get all our material for the next week, the Tuesday before that week. So some people that are on it, like since the beginning of the school year, like they're
Yeah.
already like, looking through that material since like it gets released, right? At least their first pass. And then like once they like have an idea on what it's about, they'll like go through it again and again, right? Like
Right.
it's me at least like I try to keep myself accountable and try to be at least like 3 days ahead maybe so that I'm not struggling when like the material comes around. That
Right.
Monday we have a quiz on it and then like I actually kind of know what's happening. And if for
Hmm.
instance what they provide isn't enough for me to really understand what they're trying to teach me, I'll like go to like YouTube or like I'll go to stuff. So it honestly just comes down to time management because for me like I'm like I try to be ahead and I'm also starting to incorporate like those like volunteer hours now. So
Yeah.
like I like volunteered this past weekend at like the Polverello house or something for like 2 hours.
Oh my gosh.
I
Yeah.
did like sorting of the clothes or something. So it's like it's possible. I think
Yeah.
the first couple of months, like maybe the first few blocks of as a first year, they like want to let you ease in before they like
Yeah.
allowing you to start volunteering within like the different things that clubs have to do.
Yeah.
But I think as long as you keep good time management, anything is possible.
Hmm.
Obviously, like good time management also helps with anxiety, helps you not burn yourself
For
out.
sure.
Also, still doing stuff that you love, I think is really important.
Yeah. Yeah.
Mhm.
Um, and so I would just want to move on to the next section. And these are more like sciencey questions. Um, but it's just like how it applies to your life in medical school and everything. So my first one is, how does biology apply to your medical education?
Probably the one that applies here the most. Well, our first block was MCM, so it was basically like biology, biochemistry. It was basically like the whole undergrad human bio
Yeah.
in 4 weeks.
Oh
So
my God.
definitely does apply here. And then what I realized now that I'm starting to get into like system specific, like we just started cardio pulm. So
Hmm.
it's like this is system specific now. It's like it's incorporating the stuff we use like for the underlying bios, like action potentials, like
Right.
cardiac cells or versus like smooth muscle versus something else. It's like it actually is coming into play with the with that class specifically, like that I'm taking now. The one
Yeah.
before was like I was HDM, so I think it was like immunology. So it's like you still learn it because you're still trying to get like what causes this, right?
Hmm.
And like for instance, in the immunology section, like we learned a lot about like T cells, B cells, viruses, bacteria, the differences, protozoa, everything, like, and it's all, I'm sure was what you're gonna learn as like a bio major. It's
Uh-huh.
gonna come back to haunt you. It's not like it's not gonna.
Yeah, oh my God.
I'm sure it'll still continue, like in certain blocks, like or certain like systems, we'll probably see more of something versus the other thing.
Hmm.
Like right now, it's a lot of like anatomy of the heart, like how the blood travels and goes through systemic versus pulmonary circulation. Like
Yeah.
it does come into play, I'd say like a lot.
Yeah,
That's
big
probably
portion
one of
of
the
it.
subjects that does actually come into play. Yeah.
Especially, you think it's like just the first year, or like the other years it's going to be more deviating from biology specifically?
I think possibly like so the way
Okay.
that med school works, I'm not sure if you know, first year and second year are just like you're like in the books, you're in classes.
Hmm.
Third and fourth year are literally you're in clinical rotations. So it's like
Hmm.
applying the knowledge you learned from the first and second year in real life like scenarios. Like
Right.
then that's like when you're seeing patients, like they're telling you their symptoms, they're telling you how long they've had them. You're trying
Yeah.
to like figure out like according to the lab test, like, what this differential diagnosis might be kind of thing. So it's like the first 2 years are really like content specific. And as long as
Hmm.
you get a good grasp on the content, once you're like in the field, you'll probably have a better idea on like how to like figure out differential diagnoses versus
Right.
like being like, I have no idea what this is. But
Yeah.
obviously that's what you have residency for too. It's like when you're like specific to like the specialty, obviously you're gonna learn more about like specific diseases within that specialty, right? That you see.
Yeah. Yeah, for sure. Good to know. Good to know.
Hmm.
And my next one is, how often do you think science plays into the day-to-day role of a physician, which you kind of just answered already?
Yeah, day
Yeah.
to day could be like I think it depends, right? So it's like depends like on your specialty. Obviously,
Yeah.
someone's going to have more science incorporated than others. Like obviously a surgeon is going to have to know the anatomy when they're going into a body and like doing
Yeah.
surgery, right? Whereas like for instance, maybe like something that isn't as like invasive, like maybe let's see which one would be like a good like example.
Like family med, would you
Like family
say?
medicine or like dermatology,
Yeah.
like something that's like
Yeah.
not like super invasive, like maybe they won't use as much science, but they're still using some science
Hmm.
because like let's say like the dermatologist sees this like mole and they're like, is that normal? Is it not? Is it
Yeah.
metastatic? Is it not? So it's like they're still kind of like even just by like doing an exam and seeing that they're like, okay, what's going on here? But yeah,
Yeah.
obviously some specialties I think have more science in their day to day versus others, especially when it comes to like anatomy specifically.
Yeah. Yeah. And my next one is, also, you kind of just answered it already. What scientific discipline was most valuable to you during your M1 year?
Yeah, so right now I think it's definitely anatomy. Um,
Uh-huh.
as to what I've got into now, obviously next semester we're gonna have a lot more systems classes, but right now, yeah,
Hmm.
anatomy, like obviously like the difference between like arteries, veins, stuff
Yeah.
like that, and then like different parts of the heart and everything. So that's for now. I mean, ask me again in 6 months, it might be
Yeah.
different, but I think anatomy is definitely important. And even
Yeah.
just like the basic concepts under bio is gonna be really helpful because it's like I said, it's like you're going through everything in like 4 weeks, for instance, of undergrad for like biochemistry, like including biochemistry, including like all that stuff you learn. So having a good grasp on it then will help you
Hmm.
like do well now kind of thing.
Yeah, for sure.
Mhm.
And my last question in this little topic is, well, I guess this is more M3, M4. How did you rely on your scientific knowledge to complete your clinical rotations? But you haven't done clinical rotations
No, I
yet.
haven't, unfortunately. What?
I know. So,
That's it.
so I guess I could kind of like modify this. Um, how do you think scientific knowledge plays into your clinical rotations? And I guess you kind of answered that one too.
Yeah, so I think, like I said, it depends on which clinical rotation you'll be within, right? So obviously, like if
Yeah.
it's less like hands-on and more like just like out the outer body, it's gonna probably not be as pertinent. I do think one important thing is like when you're prescribing medications, chemistry is
Mm,
definitely going to come into play because you want to make sure that the medications the patients are taking aren't going to like cause adverse reactions, right? Like that's
yeah.
really important. Like make sure to review that medication list. Make sure that if you are going to prescribe a new medication, either you yourself look up to make sure any of the medications they're currently on aren't going to like have adverse effects towards each other. Or you can,
Right.
for instance, consult like a gosh, my brain is blanking. The ones that help with medication, pharmacists.
Yeah.
Yeah, so or consult a pharmacist, like, okay, like if I prescribe this, is this going to have any adverse effects with any other thing that they're taking on their body kind of thing? So I
Yeah.
think that that's the way that science plays in possibly when you're
Yeah.
like actually in your like clinical rotations. Obviously, like
Yeah.
if you see something that's abnormal, like whether it's an imaging, that's gonna be another way that it plays in, especially like when you're trying to indicate whether it's like anatomically normal or like something's going on, right? Like if you
Yeah.
have like an enlarged heart, you can be like, that's not normal. Something else must be happening behind the scenes, and we can try to figure it out, kind of thing. So I
Yeah.
do think
Yeah.
that it will once I get there. Um,
Mhm.
like they say all the time, they're like, learn everything you can now, so that once you're in your third and fourth year through clinical rotations, like you don't feel
Yeah.
like you don't know anything. Like you at least are bringing some type of surface level. So then once you're in it, you're just adding on to what you already know because you're in like
Right.
specific scenarios and specific specialties.
Right. Right. Yeah.
Mm.
And now these last four questions are more chemistry specific. So how does chemistry apply during your M1 year? Like, have you had any significant, I guess, assignments or experiences relating to chemistry?
I want to say chemistry right now, I haven't. I think it's very
Mm-hmm.
much been bio-based. Maybe
Mm-hmm.
as we get to like the actual like pathophysiology possibly, like
Mm-hmm.
which would probably be M2 because the way that our school does is like we'll go through our first pass and our first pass is like normal, like what a normal like system will look like. And then the
Mm-hmm.
next one is where they focus on like pathology and disease. So it's like that's might be when like chemistry might come more into play. But I feel like at least with med school, like from my experience, it's been more bio-based than chemistry based.
Mm-hmm. Yeah. Yeah. Interesting. Good to know. As a biology major.
Yes, I hated
And
chem, so
actually, honestly, I'm leaning because I love organic chemistry.
oh
And
my
I'm
gosh.
kind of, I know, I feel like, I don't know, like I just, it clicks with me.
I love
But
that
like,
though.
yeah, but biochemistry and biology, I'm kind of like losing my love for it. And I'm kind of like organic chemistry. I'm an organic chemistry girl now. I don't know what's happening.
I
But
mean, you could always do a master's in OChem.
yeah,
That'd be
yeah,
cool.
always in the back of my mind, you know?
Hmm.
And my next question is same thing with clinical rotations, but do you think chemistry will come up during clinical rotations? But you
I
said
think
more with medication?
medications, like making
Yeah,
sure that them like clash with each other possibly, because obviously the chemistry of one medication might affect the other medication, either
right.
cause an adverse effect within the body or just cause it to be inactive, you know? Like you want to make sure
Yeah,
that none of them are like gonna clash with each other because at the end of the day, it's
right.
if they're already taking something for another condition, you need to make sure whatever else they're gonna take on top of that isn't
Yeah,
gonna affect that condition on top of trying to treat the one that you're trying to treat.
right, right. So you have to have a little comprehensive knowledge of everything they're on, um, just to be able to compare.
Yeah, exactly.
Yeah. And my next one is how do you think chemistry applies to the work of a physician? But basically the same thing, right? Just
Yeah,
medications
it would be
mostly.
more, yeah, it'd be more medication
Yeah.
wise. I don't know how chemistry would work anywhere else,
Uh-huh.
if I'm being honest, but then maybe it'll
Yeah.
change in 6 months. You never know. What if they're like,
Yeah.
actually, I'm is very involved in this, like, but like I said,
Yeah.
right now I've only been seeing more bio specific
Yeah.
than anything.
Yeah. Like I guess if you were like a pharmacist, maybe it would be like a really big
Yes,
deal.
chemistry would
Yeah.
probably be the biggest thing as a pharmacist for sure.
Yeah. So like pharmacy, pharmacology, stuff like that. Okay.
For
And
sure.
my last question is which discipline of chemistry, so general, organic, or whatever else there is, do you think applies the most to your medical school education so far?
I think that if you had to choose one, it'd probably be organic chemistry. Because I
Hmm.
think that might lean more towards like the medication portion versus like general chem. I also haven't
Yeah.
studied general or organic chem in a long time, so you can correct me on that.
Yeah.
That went out the window as soon as I took the MCAT. So yeah, I think that
Yeah.
now.
Like the structures and stuff like that.
Yeah, structures, like the breakdown, like within
Hmm.
like different areas, right? So it's like what ions
Reaction.
cause like reactions or what ions cause action potentials kind of thing. Which
Yeah.
I guess
Yeah.
kind of is chemistry, huh?
Yeah. Or biochemistry. Wouldn't it
Yeah.
be more into that lane?
Yes, biochemistry, exactly.
Yeah. So biochemistry, I guess that's chemistry. Yeah.
Yeah. So I
Biochemistry.
think
Yeah.
yeah, if I were to choose what discipline, it'd probably be biochemistry
Yeah.
specifically.
Yeah.
Yeah.
Ugh, that's such bad news. I'm struggling so hard with biochem right now. I don't know. It's just I feel like it's kind of like Gen Chem for me, where it's like it's just the semester that I'm taking it right now is just so much information all at once.
Yeah.
I'm just like, ugh.
Biochem is a
But
lot of information. Organic chemistry is cool because you can actually like see the structures, I think. That's probably why you like it. I think I
yeah,
remember Gen Chem, I was like, oh, I hate it here. But then when I saw like
yeah,
OChem or OChem too, I was like, actually, it's pretty cool.
yeah. And I like to with like organic chemistry, like you just have to know like a certain set of rules and you can do so much with that. You can apply it to so many different reactions. So it's not to me, it's not a lot of information. You just have to memorize just how it works and just apply it from there on out.
And I think
So
the labs are
yeah,
fun, are more fun because you're
yeah.
actually doing hands-on stuff, I remember with OChem.
Yeah, I look forward to it. I haven't been able to get in any labs yet, but next semester, hopefully I can finally get my foot in the door in the chemistry lab. But yeah, other than that, those are all the questions I have for you. That was a cool half an hour, and I don't want to take up too much time. But thank you so
Of
much for
course.
doing this. I feel like I learned a lot, even just about like medical school, what it's like to be in there. Um, and yeah, other than that, yeah, that's all I have.
Yeah, and like I said, if
Yeah,
you ever have any other questions for me, I'm just a text away. I might take
I
a little bit to
know.
respond, just depending on the week. But
Yeah.
right now we're on a second week of our 6 week block. So right now I'm
Yeah,
still like in that the loops phase where I'm like, ah, you have time. Next
I
week
know.
I'll
I'm
be
like,
like, no,
I
I know it's
know.
not early.
Yeah, and you said you get winter break or no? Just a
Yes,
couple
we
weeks.
get so our first break we have is the end of November. We have a week for Thanksgiving, and then
Yeah.
mid-December we get 3 weeks off.
Oh, nice, nice.
Yeah,
Then
you
we
have to
should
keep
schedule
going.
something in mid-December because I
Yes,
would definitely want to ask you more questions about your application process because I feel like I'm kind of like I'm so anxious about it.
yeah.
Even though it's like way in the future for me and I'm still considering doing the
It's good to
master's.
be prepared, I think. It's good to
Yeah.
be prepared and it's good to like yeah. Like I said, let me know when
Yeah.
if anything we can try to schedule something mid to end December or
Hmm.
maybe in a time like right after one of my tests or something.
Yeah.
Just figure it out.
Yeah.
You text
Sounds
me some
good.
dates, then we can try to figure something out.
Yeah, for sure, for sure. But other than that, thank you so much. I learned a lot and good luck.
Of course, thank you. You too. Okay,
Everything.
you got this. You got this biochem, okay? Don't let it
Thank
kill
you.
you.
Thank you.
All right.
Alrighty,
I'll
have
talk
a
to you
good
later.
one.
You too. Bye.